When looking for answers to questions that you have, be sure that any source you look to is reliable. There's plenty of people out there willing to tell you about their experiences and label it as fact. But it sounds like you have some specific questions about not general labor and delivery things, but you want to go unmedicated the second time around. And you want to know more about that and maybe just any random tips that might be helpful going into it again. Ask your OB provider what questions you have, and of course, if you formulate certain questions, I'd be happy to answer them for you as well. I can't recommend any specific books to you, but there are some good resources out there if you look for them. There are a couple of different programs that women look to if they're seeking an unmedicated experience. A lot of women look to hypnobirthing, some look to Lamaze, some the Bradley method, and of course there's just basic breathing and relaxation. And actually, the phrase that I probably use most in my job on labor and delivery is take slow, deep breaths. Because if you think about your normal response to pain, like imagine if you drop a hammer on your toe, you're probably likely to do a few things. Number one, you might swear, don't lie. You will probably tense up your muscles, and you're either going to hold your breath or you're going to hyperventilate. Those are your natural responses to pain. And there's actually something called a pain, fear, tension cycle. When we experience pain, we tense up, we let our emotions get involved, and this just, if we continue in that cycle, it sucks us into this vortex of increasing pain, and it's hard to get out. So if I have a patient who's hyperventilating or crying, with all the love in my heart, I tell them to stop crying, not like, to buck up, but because if you cry and let yourself lose control, it actually hurts more. The better control you have, the less pain you have. And so the best thing you can do if you're planning an unmedicated experience is teach yourself how to relax on command. And you can do this through different exercises. You can use progressive relaxation tapes at night before you go to bed. You can actually hold an ice cube in your hand. Do this with your husband and see who can hold it the longest. It's a way to inflict pain and teach you how to breathe through it without causing permanent damage. So sit there and hold it, and when it starts to burn and hurt really bad before it numbs, you just start taking slow, deep breaths and relax your muscles, and don't let yourself freak out. Just stay calm and breathe. And it's these sorts of exercises that are going to prepare you for experiencing pain during labor. If you've exercised in the past, this is also very helpful because you've learned how to coordinate efforts with breathing. For example, if you run, then you know that you have to breathe a certain way when you start to increase your pace of running. And this is very similar to contractions. So, in the beginning, when you're just having irregular, uncomfortable contractions, you don't breathe through them. But once you start to have more painful and more regular contractions and feel like you have to stop what you're doing and concentrate during them, you slow your breathing rate down and you take slow, deep breaths in through your nose, out through your mouth. And a normal pace of breathing is about 18 to 22 times a minute. And you want to slow it down to about 12 to 14 times a minute. And again, just focus on a rhythm of breathing. In between contractions, you can continue on with whatever you were doing. But then when it starts, welcome it. Don't be afraid of it, and know that every contraction you have is getting you one step closer to meeting your baby. And if you do these things, then you will be well prepared. Also, make sure you have emotional support. That's huge. And turn to the nursing staff at the hospital when you go to have your baby. They'll be more than happy to help teach you different positions you can be in depending on your circumstances. In the end, it all comes down to how well your baby's tolerating labor. But hopefully they can find positions where the baby's happy and you're able to have good pain control. And they'll also talk to you more about breathing and answer specific questions you have. But if you have any other questions that you can think of before going into the process, don't hesitate to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.